Hello, I'm Dr. James Whitaker, and what I'm about to tell you could literally save your life. 3 weeks ago, a 58-year-old patient named Robert walked into my office complaining about what he called just an annoying itch down there. He was embarrassed, frustrated, and had been ignoring it for 8 months, thinking it would go away on its own. What we discovered during his examination shocked both of us. That simple itch was actually the first warning sign of the aggressive cancer that had already begun spreading. Today, Robert is cancer-free because we caught it early, but his story could have ended very differently. If you've been experiencing any unusual itching, burning, or irritation in your genital area, and you've been telling yourself it's nothing serious, the next few minutes could be the most important of your life. What I'm about to reveal will show you exactly when that innocent itch becomes a medical emergency, and why waiting even one more week could be a decision you'll regret forever. Gentlemen, we need to have an uncomfortable but potentially life-saving conversation about something that 90% of men are too embarrassed to discuss with their doctors. Every year, thousands of men develop cancers in their genital region that begin with symptoms so subtle, so seemingly innocent, that they're dismissed as minor irritations until it's too late. The tragic reality is that while women are encouraged from a young age to monitor their bodies for changes and seek medical attention for unusual symptoms, men are conditioned to tough it out and ignore warning signs that could indicate serious underlying conditions. This cultural conditioning is literally killing us, and it needs to stop today. Here's what the medical community knows but rarely discusses openly. Cancers affecting the male genital region, including penile cancer, scrotal cancer, and certain types of skin cancers, almost always begin with seemingly benign symptoms that men dismiss as hygiene issues, allergic reactions, or minor infections. The anatomy of a deadly mistake. Let me tell you about 3 patients whose stories illustrate just how dangerous it can be to ignore these warning signs. The first is Robert, whom I mentioned earlier. Robert was a successful businessman, married for 30 years with 2 grown children. He prided himself on being tough, resilient, and not bothering doctors unless absolutely necessary. For 8 months, Robert experienced what he described as an annoying itch around his genital area. It wasn't constant, it wasn't severe, and it didn't seem to affect his daily life significantly. He tried over-the-counter anti-itch creams, changed his laundry detergent, switched to different underwear materials, and even modified his grooming routine. Nothing provided lasting relief. When Robert finally came to see me, it was because his wife had noticed a small, discolored patch of skin during intimacy and insisted he get it checked. What appeared to be a minor skin irritation was actually squamous cell carcinoma, a type of skin cancer that had been growing slowly but steadily for months. The itch that Robert had been experiencing was his body's way of alerting him to abnormal cellular activity. Cancer cells, as they multiply and form tumors, often irritate surrounding healthy tissue, creating sensations of itching, burning, or general discomfort. By the time we caught Robert's cancer, it had grown to nearly 2 centimeters in diameter and was beginning to invade deeper tissue layers. Fortunately, because we caught it when we did, we were able to treat Robert successfully with a combination of surgical removal and targeted therapy. Today, 3 years later, Robert remains cancer-free. But here's the sobering reality. If Robert had waited just 6 more months to seek treatment, his prognosis would have been significantly worse. The second warning that almost went unheeded. My second patient, Marcus, was 45 years old and had been experiencing what he described as jock itch that won't go away for nearly a year. Marcus was an athlete, spending hours at the gym and participating in recreational sports leagues. He assumed his symptoms were related to sweating, friction from athletic activities, or perhaps a persistent fungal infection. Marcus tried every over-the-counter anti-fungal treatment available. He modified his post-workout hygiene routine, started using antifungal powders, changed his workout clothes more frequently, and even took oral antifungal medications. The itching would improve temporarily but always returned, often worse than before. What Marcus didn't realize was that his symptoms weren't caused by a fungal infection at all. When he finally sought medical attention, again at his partner's insistence, we discovered that Marcus had developed a rare form of skin cancer called extramammary Paget's disease, which commonly affects the genital and perianal regions. This type of cancer is particularly insidious because it closely mimics the symptoms of common, benign conditions like eczema, psoriasis, or fungal infections. The persistent itching that Marcus experienced was actually caused by abnormal cells spreading through the upper layers of his skin. The key difference between Marcus's cancer and a simple fungal infection was the pattern of the symptoms. True fungal infections typically respond to appropriate antifungal treatments within a few weeks. When symptoms persist despite proper treatment, or when they follow an unusual pattern of improvement and worsening, it's often a sign that something more serious is occurring. Marcus underwent a more extensive treatment regimen than Robert because his cancer had been present for a longer period. However, because we caught it before it had invaded deeper tissue layers, Marcus also achieved a complete recovery and remains disease-free today. The third patient who almost waited too long. The third case that illustrates the importance of taking these symptoms seriously involves David, a 62-year-old retired teacher. David's story is perhaps the most concerning because it shows how quickly a seemingly minor symptom can escalate into a life-threatening situation. David experienced what he described as mild burning and itching that came and went over a period of about 4 months. Unlike Robert and Marcus, David's symptoms were intermittent. He might go days or even weeks without any discomfort, followed by periods where the symptoms would flare up. This intermittent pattern convinced David that whatever was causing his symptoms wasn't serious. He reasoned that if it were something dangerous, the symptoms would be constant and progressively worse. This is a common but potentially dangerous misconception. Many cancers, especially in their early stages, can cause symptoms that wax and wane. Cancer cells don't grow at a constant rate. Their growth patterns can be influenced by factors like hormones, immune system activity, blood flow, and even stress levels. This means that the symptoms they cause can also fluctuate. When David finally sought medical attention, we discovered that he had developed penile cancer that had already begun to spread to nearby lymph nodes. The intermittent itching and burning he had experienced were early warning signs that his immune system was trying to alert him to the presence of abnormal cells. David's treatment was more aggressive and complex than what Robert or Marcus required. He underwent surgical removal of the tumor, lymph node dissection, and adjuvant chemotherapy. While David ultimately achieved remission, his recovery was more challenging, and he experienced more side effects from treatment than he would have if the cancer had been caught earlier. If you're serious about protecting your health and catching potential problems early, make sure you subscribe to this channel and hit that notification bell. I share critical health information for men every week that could literally save your life, and you won't want to miss what's coming next. Now that you understand how serious these seemingly minor symptoms can be, let's talk about how to differentiate between normal, benign itching and the type of itching that requires immediate medical attention. Normal genital itching is typically caused by factors like poor hygiene, irritation from soaps or detergents, fungal infections, or allergic reactions. This type of itching usually has specific characteristics. It responds to appropriate treatment within a few days to weeks. It's often associated with visible signs like redness or scaling that improve with treatment, and it doesn't recur once the underlying cause is addressed. Cancer-related itching, on the other hand, has distinctly different characteristics that every man should know how to recognize. First, it tends to be persistent despite appropriate treatment. If you've tried antifungal treatments, improved your hygiene, switched to gentle soaps, and the itching continues for more than 4 weeks, this is a red flag that requires medical evaluation. Second, cancer-related itching often occurs in conjunction with other subtle changes that might be easy to overlook. These can include changes in skin color or texture, the appearance of small bumps or lesions, areas of skin that feel thicker or rougher than surrounding tissue, or persistent redness that doesn't respond to typical treatments. Third, the location and pattern of cancer-related itching can be distinctive. While fungal infections typically affect skin folds and areas where moisture accumulates, cancerous changes can occur anywhere in the genital region and often follow unusual patterns that don't correspond to typical infection sites. Through my years of practice, I've identified several dangerous misconceptions that prevent men from seeking timely medical attention for potentially serious symptoms. Understanding these misconceptions could be the key to catching a life-threatening condition early. The first misconception is that cancer always causes severe, obvious symptoms. Many men believe that if they had cancer, they would know it because they would be in significant pain or have dramatic, unmistakable symptoms. The reality is that many cancers, especially in their early stages, cause subtle symptoms that are easy to dismiss or attribute to other causes. The second misconception is that young men don't need to worry about cancer in the genital region. While these cancers are more common in older men, they can and do occur in men of all ages. I've diagnosed penile cancer in men as young as 35 and scrotal cancers in men in their early 40s. Age should never be a reason to ignore persistent symptoms. The third misconception is that good hygiene prevents all genital health problems. While proper hygiene is certainly important for preventing infections and irritation, it cannot prevent cancer. Some of the most health-conscious men I've treated have developed serious conditions despite excellent personal care habits. The fourth misconception is that if a symptom isn't getting worse, it's not serious. Many men use this reasoning to justify delaying medical evaluation. If it were something serious, it would be getting worse, and since it's staying the same, it must not be a big deal. This logic is flawed and dangerous. Many serious conditions, including cancers, can remain stable for extended periods before suddenly progressing rapidly. Given the potential seriousness of persistent genital itching and related symptoms, it's crucial to know when to seek medical attention. Here are the specific guidelines I give to my patients about when symptoms require professional evaluation. Seek medical attention within 1 week if you experience persistent itching, burning, or irritation in the genital area that doesn't respond to basic hygiene improvements and over-the-counter treatments within 7 to 10 days. Don't wait to see if it goes away on its own. Seek medical attention within 48 hours if you notice any visible changes accompanying the itching, such as new bumps, lesions, areas of discoloration, or changes in skin texture. These visual changes, combined with persistent symptoms, require prompt evaluation. Seek immediate medical attention if you experience severe itching, accompanied by pain, bleeding, discharge, or rapid changes in the appearance of your genital area. These symptoms could indicate a rapidly progressing condition that requires urgent intervention. Don't forget to leave a comment below, telling me about any concerns you might have about unusual symptoms you've been experiencing. Your question could help other men recognize important warning signs in their own health. Understanding what happens during a medical evaluation for persistent genital symptoms can help reduce anxiety and encourage men to seek timely care. Here's what you can expect when you make that important appointment. Your doctor will begin with a detailed medical history, asking about the onset, duration, and characteristics of your symptoms. Be prepared to discuss when the symptoms first appeared, whether they've changed over time, what makes them better or worse, and what treatments you've already tried. The physical examination will involve a careful visual inspection of the affected area. Your doctor will look for signs of infection, inflammation, or abnormal tissue changes. This examination is typically brief and professional, and remember, your doctor has seen it all before. There's nothing to be embarrassed about. Depending on what the initial examination reveals, your doctor may recommend additional tests. These might include a culture to test for bacterial or fungal infections, a biopsy of any suspicious areas, or referral to a specialist for further evaluation. If a biopsy is recommended, don't panic. A biopsy is simply the removal of a small tissue sample for microscopic examination. It's the gold standard for diagnosing or ruling out cancer, and it's often the only way to definitively determine what's causing persistent symptoms. The treatment for persistent genital itching depends entirely on the underlying cause, which is why proper diagnosis is so crucial. For benign conditions like fungal infections, bacterial infections, or allergic reactions, treatment is typically straightforward and highly effective. If the itching is caused by a fungal infection that hasn't responded to over-the-counter treatments, your doctor may prescribe stronger antifungal medications or recommend changes to your hygiene routine that can help prevent recurrence. For bacterial infections, appropriate antibiotic treatment usually resolves symptoms quickly and completely. However, it's important to complete the entire course of antibiotics even if symptoms improve before the medication is finished. If the symptoms are related to an allergic reaction or contact dermatitis, identifying and avoiding the trigger substance is key to preventing recurrence. Your doctor may also prescribe topical corticosteroids to help reduce inflammation and provide symptom relief. For more serious conditions like precancerous changes or early-stage cancers, treatment options have improved dramatically in recent years. Many early-stage cancers can be treated with minimally invasive procedures that preserve function and appearance while providing excellent cure rates. The key message here is that early detection and treatment lead to better outcomes across the board. Whether we're dealing with a simple infection or something more serious, catching it early means easier treatment, better results, and less impact on your quality of life. While we can't prevent all types of cancer, there are evidence-based strategies that can significantly reduce your risk of developing genital cancers and help you detect problems early when they do occur. First, practice good hygiene without overdoing it. Wash the genital area daily with mild, unscented soap and warm water. Avoid harsh soaps, douches, or other products that can irritate sensitive skin. After washing, dry the area thoroughly to prevent moisture buildup that can promote bacterial or fungal growth. Second, perform regular self-examinations. Just as women are taught to examine their breasts for changes, men should regularly examine their genital area for any new bumps, lesions, changes in skin color or texture, or persistent symptoms. The best time to do this is after a shower when the skin is clean and you can see clearly. Third, practice safe sex and consider HPV vaccination if you're eligible. Human papillomavirus, HPV, is linked to several types of genital cancers in men. Using barrier protection during sexual activity and getting vaccinated against HPV, if you're within the recommended age range, can significantly reduce your risk. Fourth, don't smoke and limit alcohol consumption. Both tobacco and excessive alcohol use increase the risk of various cancers, including those affecting the genital region. If you currently smoke, quitting is one of the best things you can do for your overall health. Fifth, maintain a healthy weight and exercise regularly. Obesity is linked to increased cancer risk, while regular physical activity boosts immune function and helps your body fight off abnormal cells before they can develop into cancer. One of the most important factors in catching serious conditions early is maintaining a relationship with a healthcare provider who knows your medical history and can track changes over time. Many men only see doctors when they're sick, but this reactive approach can lead to delayed diagnosis of serious conditions. I recommend that all men over 40 have annual physical examinations that include discussion of any genital health concerns. Men with risk factors for cancer, such as a family history of cancer, previous HPV infection, or compromised immune systems, may need more frequent monitoring. During these regular visits, don't hesitate to mention symptoms that seem minor or embarrassing. Remember, your doctor has heard it all before, and mentioning concerns early can help establish a baseline for comparison if symptoms change or worsen over time. Let's address something that many men consider when deciding whether to seek medical care: the cost. It's natural to worry about medical expenses, especially for symptoms that seem minor. However, the financial reality strongly favors early detection and treatment. A routine office visit to evaluate genital symptoms typically costs between $150 and $300. Basic diagnostic tests like cultures or simple biopsies add another $200 or $500 to the total cost. Even if you don't have insurance, the total out-of-pocket cost for early evaluation and treatment of benign conditions is usually under $1,000. Compare this to the cost of treating advanced cancer, which can easily exceed $100,000, $200,000 for surgery, chemotherapy, radiation therapy, and follow-up care. Beyond the direct medical costs, advanced cancer treatment often requires time off work, additional care from family members, and may result in permanent changes that affect quality of life. But the most important consideration isn't financial. It's the difference between a condition that's easily treatable when caught early versus one that becomes life-threatening when treatment is delayed. I understand that learning about the potential seriousness of seemingly minor symptoms can create anxiety. It's natural to worry when you realize that something you've been ignoring could potentially be serious. However, I want to emphasize that the vast majority of genital itching and irritation is caused by benign, easily treatable conditions. The goal isn't to make you paranoid about every minor symptom, but rather to help you recognize when symptoms warrant professional evaluation. Think of it like the warning lights on your car's dashboard. Most of the time, they indicate minor issues that are easy to fix, but ignoring them can occasionally lead to major problems. If you're experiencing symptoms that are causing you to worry, the best thing you can do for your peace of mind is to get them properly evaluated. Uncertainty and anxiety about what might be wrong is often worse than dealing with a definitive diagnosis, even if that diagnosis requires treatment. Based on everything we've discussed, here's exactly what you should do to protect your health and catch potential problems early. First, if you're currently experiencing any persistent itching, burning, or irritation in your genital area that has lasted more than 2 weeks despite basic hygiene measures, schedule a medical evaluation within the next week. Don't wait to see if it goes away on its own. Second, if you haven't had a physical examination in more than a year, schedule one now. Use this as an opportunity to discuss any health concerns, no matter how minor they seem, and establish a baseline for future comparison. Third, start performing monthly self-examinations of your genital area. Look for any new bumps, lesions, changes in skin color or texture, or areas that feel different from the surrounding tissue. If you notice anything unusual, don't assume it's nothing. Have it evaluated. Fourth, review your risk factors and discuss them with your healthcare provider. Factors like family history of cancer, previous sexually transmitted infections, smoking history, and immune system status can all affect your cancer risk and may influence how frequently you need screening. Fifth, make sure you're up to date on preventive measures like HPV vaccination if you're eligible, and discuss with your doctor whether you might benefit from more frequent screening based on your individual risk profile. As we conclude today's discussion, I want to leave you with this critical message. Your life and health are infinitely more valuable than any temporary embarrassment you might feel about discussing genital symptoms with a healthcare provider. Every year, I see men whose lives could have been saved or dramatically improved if they had sought medical attention sooner for symptoms they thought were no big deal. I also see many more men who come in worried about symptoms that turn out to be completely benign and easily treatable. In both cases, seeking prompt medical evaluation leads to better outcomes. For the men with serious conditions, early treatment means better prognosis, less invasive treatment, and higher cure rates. For the men with benign conditions, proper diagnosis provides peace of mind and effective treatment that resolves symptoms quickly. Remember the stories of Robert, Marcus, and David that I shared at the beginning of this video. All three men initially dismissed their symptoms as minor irritations, but their outcomes were dramatically different based on how quickly they sought medical attention. Robert and Marcus, who received earlier treatment, had simpler treatment courses and better outcomes. David, who waited longer, required more aggressive treatment and experienced more side effects. You have the power to choose which category you fall into. Don't let embarrassment, fear, or the assumption that symptoms will resolve on their own prevent you from getting the care you need. The strange itch below the belt that we've discussed today could indeed be a sign of cancer, but it could also be a sign of any number of easily treatable conditions. The only way to know for certain is through proper medical evaluation, and the sooner you get that evaluation, the better your outcome will be regardless of what we find. Your health is not something to gamble with, and your life is too valuable to risk on. Assumptions. If you've been experiencing persistent symptoms, make that appointment. If you haven't been keeping up with regular medical care, start now. And if you know other men who might benefit from this information, please share it with them. Thank you for watching, and remember, taking care of your health isn't just about you. It's about being there for the people who love and depend on you for years to come. I'll see you in the next video where we'll discuss more critical health topics that every man needs to know.